Source of the listeriosis outbreak has been identified as enterprise processed meats. Focus now falls on the management and prevention. Well, Vinay Moodley is the Director of Michem Dynamics with a team of qualified microbiologists, auditors and management systems experts, and their primary focus is to be the link between the laboratory and manufacturing industry by means of interpretation of results, root cause analysis and implementing corrective actions. He joins us now on the line from Johannesburg. Thank you very much indeed for joining us on the line. Mr. Moodley, perhaps you can start by telling us, as someone who deals with trying to track, assess and measure these kinds of germs, is it normal for it to take so long to track down the source of an outbreak like this?
Hi guys, yes. Look, people infected may only be able to see symptoms of this listeriosis between 1 week to just over 2 months. So that is quite scary when you consider how many of us can't even remember what we had eaten just 24 hours ago. So that's been the most challenging. In addition, I think listeria is also able to contaminate a wide range of food products. So from a microbial test perspective, there was a huge number of potential sources that would have been considered. But well done to those who were involved in tracking down the source, and good work can now commence to try to remove this microorganism from the industry.
All right. Is it possible to say with conclusivity at this stage, because we've just been listening to the press conference and Tiger Brands seem to be saying that there's no direct link with their products and the deaths of the people that have succumbed to listeria. Is there a way to conclusively prove that link, and how would you go about doing that?
Look, that'll be further sequencing of the DNA sequence of the actual strains that did kill the people and the one that did find in the food. So there would be a link to that, but I think that's a further process later on with a lot of testing that's going to be required for that. So I think that's going to take quite a bit of time, yeah.
So they're talking about having tested, and they said that they found low levels of listeria. Could those still be harmful?
There is an effective dose, so normally they range over around 100,000 colony-forming units per gram. So yes, it is possible, but I think further research must be done and further investigation into such claims.
All right, so let's assume that it's not just these two places. Could it be further afield, and that we shouldn't stop looking just because we've identified these two places? 100%.
Look, listeria has been in the industry for a while now. Even though there's just one strain, the ST6 strain, that has been shown to cause death, there's definite concern for us to keep testing and keep analyzing on a sequence level to try and identify the pathogenic strain, yes.
All right, so we're starting with what we think we know, these two places, Polokwane and Germiston. If that is the case, then where do we go from here to try and contain this listeria outbreak?
Look, it will start at the retailers. I think they've already put on a list together of possibly infected products, and for the customer to return those products to store to aid in the product recall process. I think also keep in mind, simply throwing it away in the rubbish still has the potential to be consumed and possibly spread infection. In addition, thorough cleaning of refrigerators and all other areas where the product was stored or placed is necessary to reduce the risk of such contamination. So those are ways in which we can use to try and contain the problem.
And what about us as consumers? You know, we've been hearing about washing hands, washing vegetables, and now it's showing up in our polony packets.
Yes, definitely. Look, so it was a process problem, I would assume. But look, in our refrigerator where we store it, we would start by deep cleaning those appropriate areas using possibly chemicals with different active ingredients that are effective against listeria. So proper cleaning using household names such as bleach and soap. We would also consider using different utensils from meat than our fresh produce. So we've got to keep in mind that meat still has to be cooked, while fresh produce generally does not get further processed. So there's a risk there as well of consuming it in that regard.
All right, I'm just going to ask another question, and perhaps you can help us. So let's assume a product leaves the factory in Germiston and it goes to a shop. Somebody buys it from that shop, and they are setting up a little tuck shop somewhere else. They cut this polony into small pieces. We don't know how they're caring for this stuff. Could this listeria infection happen much further down the line, far away from the factory?
100% correct, yes. So we can take a problem that could happen at factory level that could be in a dosage that won't affect us as a human population. But you can imagine as the chain goes further down, if the cold chain is not maintained, proper hygiene levels are not maintained, hygiene management systems not being fulfilled, we can then get a problem leading to a death, as we've had this year.
All right. So you work with these manufacturers all the time, and I just wonder, during the course of the year, what kind of things are they doing or should be doing and testing for?
So at the moment, there's been a huge increase in microbial testing for listeria, specifically the monocytogenes species. So that's the one that could potentially contain the ST6 strain. So that's what laboratories are doing, and food manufacturers were testing, and those then isolated. They did isolate it, were sent for further DNA sequencing that would then tell us if it was the ST6 strain. Look, there are other listeria species that is there in the environment that will cause no harm to human population.
All right. Vinay Moodley, we're going to have to leave it there. Thank you very, very much indeed for your insights on this listeria outbreak and some of the things that are being done and could be done.